Hello, and thank you for joining us for Wisconsin Parkinson Association's educational video series. I'm Jeremy Otte, Director of Outreach and Education with the Wisconsin Parkinson Association. WPA provides hope, community, support, and resources for people with Parkinson's and their loved ones. Today, we are talking with Stacie Opahle, owner of Caring Senior Service. We are going to discuss how home care looks today with Safer at Home and what they are doing to protect you and your loved ones. Welcome, Stacie. Thank you for joining us today.
Thanks so much, Jeremy. It's nice to be here.
Thanks. Well, can you tell us a little bit about who you are and what Caring Senior Service does?
You bet. So my husband and I own Caring Senior Service in Milwaukee. We are a home care provider, sometimes called non-medical care, sometimes called custodial care, supportive home care. All of it means the same thing. We have caregivers that provide one-on-one care to seniors in our community in their homes.
So I think you kind of just touched on a little bit about the typical services you provide, but can you tell me, like, when you go in to do an assessment, what type of things are you looking for when people are looking for home care or home health services?
Absolutely. So any of us in home care provide really two different types of services. We provide companionship care and we provide personal care. So companionship care could be somebody who needs help with more of supporting their household. They may need help with housekeeping, laundry, meal preparation, medication reminders. Maybe it's running errands, taking them to appointments. And then other people need personal care. So these are the people that might need an actual assistance with things like bathing, toileting, dressing, help with transferring from a bed to a wheelchair, getting up from a chair. They might need somebody to walk with them for safety if they're a fall risk. Or it could be helping them with exercises to keep their limbs moving and making sure that they're getting in their range of motion throughout the day. So companionship and personal care. And when we go in and we assess somebody, it's really specific to the client. So we're finding out what do they need in order to be able to stay home and be safe.
And when you say you really talk to the client, you're talking to the individual with maybe Parkinson's disease in this circumstance, but you're also probably talking to the care partner or spouse, right? And finding out what they maybe need.
Yeah, absolutely. So when we're starting care with somebody, we're looking at the whole household. And for us, that's not just the physical building that they're living in, but that's anybody who's involved in that care. So we do have a lot of spouses that we care for where maybe one of them has a more critical diagnosis, but really we can help both of them with different things around the house and in their everyday to really make their life better. When I'm meeting with families, I always say that we want to take away all of the care that needs to be done, right? The things like the grocery shopping and changing somebody and helping them in the bathroom. And instead, we want to give them the time to be able to enjoy each other and make those memories and not have to worry about always providing the care.
I think that's a great point, Stacie, when you talk about, helping with maybe the toileting, the changing, the showering. When you're a care partner, you're a spouse oftentimes. And when you start doing that, that spouse relationship, caregiver relationship maybe changes a little bit. So letting them know that that's a service you guys can provide, I think is really important for them to understand.
Yeah, that's always our main goal. And it could be spouses, it could be children, it could be good friends, right? Ultimately, our goal is the time that people have together. We want that time to be special, and we want that time to be about enjoying each other and making memories.
Great. Well, you've been providing home health services for a while. Things have changed. COVID-19 pandemic is happening right now. We're safer at home. So can you touch on how maybe some of those services have changed, or have they changed at all with the new stipulations in place?
Yeah, absolutely. So definitely there's been changes that have happened with CARES. The biggest thing is that we've really had to address how much a person is dependent upon home care at this point. So we have some clients that maybe we've only been providing more of the companionship care where we've been helping them with errands. We might come in and spend some time socializing, where it's really safer for them to have fewer people into their home. So it might be a reduction in hours. It might be some people have actually stopped services temporarily and had some of their loved ones come to live with them for the time being, and that's the safest decision for them. Other clients that we take care of anywhere from 12, 20, 24 hours a day, those we've looked at seeing how few caregivers we can get in. So we've moved to longer hours where the caregivers are working. Some of them we've actually moved to a live-in structure, just so that we're really limiting the people coming in from the outside, the amount of change that's happening day to day. So that's been a really key piece of it. All of us in home care do have what's called an EPPI. It's our emergency planning and preparedness that we put into place. And so anytime that we start care with a new client, we make sure to identify what their level of care is. Are they a person who, regardless of any natural disaster, any pandemic that goes into place, they have to have care? It's critical for their survival. Or are they a person that could potentially go a couple of days, have supplies brought in a different way, thrive via phone calls, via video chats versus in person? So that was a big thing that we had to put into place with this pandemic, to make sure that no matter what happens, if we are having to take caregivers out of the field, that we're able to identify those that no matter what happens, we are going to be there. We're going to make sure that they're getting the care that they need in order to survive through this. So it's really been addressing each client's personal needs, seeing how we can reduce the amount of caregivers coming in and out, and what adjustments we can make just to reduce, how many times they're opening the door, how many times they're seeing different people throughout a week.
And I think I jumped over the first question. Probably was, obviously we can still have home health services with COVID.
Correct. Yep. So we're actually getting quite a few new referrals throughout the weeks. It seems like a lot of people are taking the option of staying home at this point versus potentially a move into a community just for the time being. Obviously, we're talking with them about what the safest option for them is. That's ultimately most important to us. But most of us are taking on new clients. Just some additional screening questions to begin with to make sure that we can keep them and our caregivers safe.
That makes sense. I've heard from two different groups. I've heard from spouses or care partners that they've been looking for services just because they need the respite. They're providing 24-hour care now, where maybe it used to be they would go to an adult day or go somewhere else. So I'm sure that you've heard from them. And then I've also heard the flip side, that if people were in the hospital because of maybe a Parkinson's issue or another related issue, they're maybe getting sent out a little sooner than normal because they wanted to get them out of the hospital and get that back there. So you're probably seeing a lot of referrals from those two types of networks, I would assume.
Yeah, it's kind of the same referral sources, but definitely a little more urgency in the calls that we're getting, that it is people who are being sent home or asked to stay home, where normally they may have an additional option.
So you talked a little bit about, the doing everything you can to make sure they're staying the same caregiver, trying to keep some consistency in their life. What are some of the precautionary measures you're taking with the caregivers before they go into a home that maybe we didn't do as much before the pandemic happened?
That's a great question. It's definitely been a shift in our day-to-day. The biggest thing for us has been making sure that we can provide the PPE that's necessary to provide safe care for our clients, and also to protect our caregivers and their families. So we have been able to get a lot of resources. We have provided N95 respirators for each of our caregiver and client matches. We provide a surgical mask for every caregiver for every shift. Gloves, we've been bringing into every household, even if we're not providing personal care, just for safety. I've been working around the clock to get my hands on any kind of disinfectant, hand sanitizer, those types of items, so that as we begin to dwindle down in the households, we're able to bring that out. It's a little bit different when you're running a home care agency, because instead of everybody being in one place, we have many people out in many different places in the community. So we don't just need one bottle of hand sanitizer, we might need 50. So that's been a big challenge for us, but something that we've committed to. We do have all of the necessary PPE available to us if we were to have somebody who was COVID-19 positive that needed care. We're fortunate that we've not run into that situation yet, but that includes things like face shields, the full body suits that are available, shoe covers, things like that. So all of that's available. We've had continuous training that we've sent out to the field. So a lot of new information that we're sharing in terms of updates. The caregivers had to take regular quizzes so that they know the disease that we're talking about, how to properly care for our seniors, what's changed now that we can't do things like take them out to outings, right? How can we still engage them in their homes without the resources that we used to have, or the places that we used to be able to go? So a lot of different training that we've had to put out pretty quickly. There's also a symptom checker that we've put into place. So our agency is pretty strong technologically. So one thing that we've done is every caregiver an hour before working their shift receives an automated symptom checker. They have to fill that out as a screening tool before they're able to work their shift. And that's just a precaution. And then we ask them to do the same for our clients. So for each of our clients, they're screened twice a day. Their temperature is checked, and then they're also screened for symptoms, again, just for safety, so that anything that comes up, we can stay proactive about. And then the last thing, probably the biggest change, has been, since we can't go in and we can't physically check on our clients, we being the management, we have had to make use of the technology. So we're fortunate that we do have a tablet in each of our clients' homes that we provide care to. And so we've been scheduling video calls with our clients and with their caregivers. So instead of going in and providing personal in-person supervisory visits, we've still been able to stay face-to-face with them so that our caregivers feel supported, and so that our clients know that we're still checking in on them and making sure that they're doing okay.
Those are some big changes. And you answered one of my questions. I was going to ask if you do the symptom checker with the patient, with that client, but you said that. How are you finding the clients and even the staff adjusting to having to use technology more than maybe the face-to-face that used to be so much of what we did day in and day out?
I would say it's 50-50. So some of them embrace it. Our younger caregivers are pretty used to technology in the day-to-day. So that's not as big of an adjustment. The hardest part comes with our clients that may not cognitively be able to grasp what's happening. And in that situation, then our focus with our caregivers is really to just keep day-to-day as normal as it can be. Obviously, it involves, some additional cleaning when they're in there. We do ask that they wear face masks for the safety of our clients. And so sometimes you have to explain the reason for that many times, and in much simpler terms than, talking about this pandemic and COVID-19, and just, making sure that our clients know that we're just trying to keep them safe. So it's been a bit of a change. Not as much as you would think. We've had some really positive feedback from our clients, from the caregivers, from their families. They're glad that we're still checking in and we're able to provide that face-to-face. It's just in a different way.
Well, and I think that face-to-face is so huge. So being able to do it at least that way, it keeps people connected. I think that's excellent to hear. And I can tell you from our end, working with Parkinson's, people We've been doing a Facebook Live exercise program, and the number of people we've taught how to download and use Facebook in the last 3 weeks. Would never expected that to be part of what we do, but that's what's been happening. So it is very cool to see. And then I talked to a woman about 4 weeks ago. We were talking about just what can you do for isolation. And the one thing we talked about, I think you just really highlighted, Stacie, was thank gosh it happened now because of the technology we have. You and I can do this video without being in the same room. You can provide patient care without actually being there once in a while. And I know a lot of doctors are doing virtual visits as well. So technology-wise, we can stay connected. It's just not the familiarity or the one-on-one comfort that we're used to. You've touched a little bit on the services you offer. So if I or a loved one of mine is considering reaching out and saying, you know, I think mom needs a little bit of respite, and I think dad needs a little bit of help with certain things around the house, what are the types of questions I should be asking a provider when I reach out to them to offer these services? And when you think about that, think of what should I be asking today during the pandemic? And hopefully 2 months from now, when some of this has changed and maybe a little, it's not as stay at home as we are now, what are the questions I maybe should be thinking of that as well?
Yeah, that's a great question, Jeremy. So anytime somebody is even considering home care, I always recommend that they do talk with a couple different providers, because even though we all offer the same types of services, we all do it in a little bit of a different way. And I do strongly believe that you have a feel for the agency that really fits best for you and your loved ones. So I always recommend that you call a couple of people, even sit down with a couple of different agents. And then there's some things that are different with all of us. So all of us provide about the same type of services, like I mentioned, the companionship care and the personal care. But then there's some differences. So obviously during the pandemic, the most important thing right now is everything about safety. So what is the agency doing? What type of PPE are they providing for their caregivers? How are they scheduling? So that's a really big one, because you want as few people as possible. And more than that, you don't want the caregivers to be going into 3 or 4 different clients' homes. You want them to be working with 1, maybe 2 clients. So definitely questions around the safety during this whole COVID-19 time. From there, there's always a couple of things that I tell people to ask about. So the first comes down to the paperwork, and every agency does this differently. Some agencies will have you sign a contract with them where you're committed to the times that you sign for and for a certain amount of time. Other agencies will have a service agreement where you're giving them permission to come in and care for you or your loved one, but there might be a little bit more flexibility in that agreement. Payment is also different for everybody. So some agencies will require a down payment. They may require you to pay for services ahead of time. Other agencies will have you pay on the back end. They'll have you pay for services after they've been rendered. So that's a difference that I always encourage people to ask about. One of the biggest things that I don't think people ask about enough is what happens if my caregiver can't make it for the shift that they're scheduled. And this is really important, because if you're planning on that caregiver being there, you want to make sure that somebody comes, and every agency handles this differently. So you want to know if a caregiver cannot make it, or if a caregiver doesn't show up for the shift that they're scheduled. What does the agency do? Are they going to send somebody else? Is that shift going to be canceled? Is it going to get rescheduled? Make sure you ask about that. Screenings are another big thing. So what does the agency do for screenings of their caregivers? Do they do background checks? Do they do national and local? Do they talk with professional references? Do they run their DMV record? Do they require experience? Or do they train people that may just be starting in the field? So those are all really important things to know, so that you know who's coming into your home. Another thing is to ask about the liability insurance that the agency provides. So any reputable agency should carry liability insurance, and that's to cover you and it's to cover the caregivers. So make sure to ask them about that. And then a big one that I think so many people are afraid of is ask if it's okay to request a different caregiver if the person coming in just might not be the right fit for you. There's so many different personalities. There's so many different things that I might do great and somebody else might do better. And so just because I think I might be a great fit for you doesn't necessarily mean that that's true. So make sure to ask about what flexibility you have in choosing the person that's going to work with you. At our agency, we always tell our caregivers that we're guests in our families' homes. And that's a big thing to keep in mind. So make sure that you're comfortable with knowing what your options are.
I think those are all really great questions for them to consider, Stacie. I think two of them I want to touch on. You said background checks are really important. Correct me if I'm wrong, I believe in the state of Wisconsin, those aren't required for all home care agencies. So that's why it's important to ask if they do them, correct?
Correct. So one thing a lot of people don't know is that in the state of Wisconsin, there's no state license that exists for home care. So without it sounding too scary, the reality is that you, Jeremy, could go out tomorrow and you could start your own agency and you could start caring for people. It's much different than, a senior community or a home health agency that has nurses coming in. There's not a license, which means it's not regulated by the state. And because of that, then there's not requirements in place. So again, any reputable agency should be running those checks. You should be doing background checks. They should be done at the state level. They should be done at the national level. People haven't always lived in the same state for their whole lives. So that's a really important thing to ask.
And then the other one you touched on was liability insurance. And I think you touched on it, but I think it's important for people to understand the liability insurance is protecting me as the client as well as you, because if the caregiver slips on some water in the bathtub and hurts her ankle, if the liability insurance is there, it won't be just my responsibility to pay it, correct?
Correct. That's the number one thing that I talk through with people who are even considering private caregivers. I always touch on the liability. What happens if something gets broken in your home? What happens if that caregiver has an injury? What happens if your loved one has an injury? It's a really important thing for you to consider is how is that going to affect you financially? And how is that going to be covered by the agency?
One other question I kind of have on the whole, the services you offer, are these services covered by insurance, or how do most people usually pay for these?
Yeah, so a lot of our clients are private pay. That's pretty standard with supportive home care. We, as an agency, do take long-term care insurance, and we work with pretty much every provider. I think we've had contracts with almost all of them at this point. So the biggest thing, if you do carry a long-term care insurance plan, is to ask the agency whether they will become your assignment of benefits or whether you need to pay the agency and then get reimbursed from your long-term care insurance. This is a big thing, and again, questions to ask that a lot of people don't know about. It's kind of half and half. A lot of agencies will require you to pay the bill and then get reimbursed, and others will become that assignment of benefits so that you don't have to worry about any of the money transactions that happen. So we do take long-term care insurance. There have been a few state plans that we work with and we have some current contracts with. So we do work with IRIS and we do work with community care. There are some agencies that will have contracts with the state for Medicaid coverage. Usually in that scenario, I recommend that you reach out to the state at that point to find out who those providers are, because not all of us do work with the state Medicaid. There's also some providers that have VA contracts. So if you or your spouse is a veteran, there are different home care agencies that will work with the VA as well.
Thank you. And those are great resources. And I think one of the things you probably demonstrated with all the questions you ask and all the resources to consider is why it's important to make this decision long-term, not decide on Tuesday that I need care on Wednesday. Because it's hard to get all those questions answered in a 24-hour window.
Yeah, and the thing that I always recommend to people is many of us are able to provide what we call emergency care, right? If something comes up, we've had it where maybe it's your spouse is your primary caregiver and something happens and all of a sudden they're in the hospital without any warning, right? So we can all provide emergency care where we can start services right away. If you're able to plan for it, it's truly better for you. It allows agencies more time to plan consistency in your scheduling, especially now, right, where we're trying to reduce the number of caregivers going into a client's home, that if we have some notice, that allows us to be able to schedule better, and that only benefits you as a client. And then exactly what you touched on, if you plan ahead, then you can really take your time to research who's going to be the best fit for you and your family.
Well, thank you. Is there anything we haven't touched on, Stacie, that you're like, I really want to make sure I touch on this before we go?
I think I've shared all of my recommendations. The biggest thing is I really think that now more than ever, we all need to just keep our eyes towards the positive. It's a really hard time for all of us. I know I had shared that I have a 5- and 7-year-old at home, and so along with running a business, I'm also learning how to be a homeschool teacher. So there's so much change and it's happening day to day, and we all just need to stay positive. We need to trust that decisions are being made for the best of us and do what you can to stay safe. There's tons of resources available, so make phone calls and reach out to those in your community so that we can continue to get through this together, but also make sure that you're able to stay safe.
I think that's a great point. I think we're wearing a lot of hats, and I think we, on top of appreciating our healthcare professionals, I think we all appreciate our teachers just a little bit more right now, don't we? Before I wrap up, Stacie, one thing I did want to ask you, Caring Senior Services, or Caring Senior Service, what's your coverage area, and how would I find you if I'm looking for your information?
Great question. So we service the greater Milwaukee area, so up to Grafton, Cedarburg, around through Menominee Falls, Germantown, over to Oconomowoc, and kind of everything east of there. So a pretty big service area. You can reach us in our office at 414-395-8106, or you can visit us online at caringseniorservice.com. And we are available 24 hours a day.
Well, Stacie, thank you so much for your time today and providing us on updates on home care continues to serve people during our current pandemic and some of the changes that have happened. While we are all practicing social distancing, please check in with Wisconsin Parkinson Association frequently. We are regularly updating our website and Facebook page with exercise classes, educational videos such as this one, and lots of other resources for you to stay safer at home. Please email us at mail@wiparkinson.org with future topics you'd like to see covered by local experts. Thanks again to Stacie for being our guest today. Thank you for joining us, and please take care.